www.humananatomy.com.
In this lesson, I will talk about the muscles of the upper limbs, and more precisely, I will talk about the group of the vertebral column. First muscle we should start with is the trapezius muscle. This is the right trapezius muscle. I will first explain the origin of this muscle, then I will explain the insertion, and then we're going to talk about the function of this muscle. The trapezius muscle originates from the skull and some vertebrae. This part of the skull here, then it also originates from the vertebrae from C7 till T12. So from here, this is the 7th cervical vertebra. So it originates from all these vertebrae, and more precisely from the spinosus process of these vertebrae. Now, as I said, it also originates here from the skull, and now I prepared an image to show you more precisely where does it originate. Here you see the skull from below. It originates here from the external occipital protuberance, then from the nuchal ligament and the medial part of the superior nuchal line. So this line here, the medial part of it, and the external occipital protuberance. Now if you look at this body from the front point of view, you will see this bone here, and this bone is called the clavicle. If you watch the lessons in my software about bones, I explained the thirds of this clavicle, and I said that these thirds are important because of the insertions of the muscles. And right here on the lateral third of the clavicle, we have the trapezius muscle insertion here. Then it also inserts in the acromion. This here is the acromion of the scapula, and it also inserts here in the spine of scapula. Now the major nerve supplying the trapezius muscle is the cranial nerve number 11. The cervical nerves C3 and C4 receive the information about the pain in this muscle. We have the superior trapezius, we have the inferior part of the trapezius, and the middle part of the trapezius. Now, depending upon how they contract and which one does not contract, dependable on that, we have the different functions. Now, this is very logical. The superior part here elevates the scapula. When this contracts, the scapula is elevated. Also, we have the inferior part here, or the ascending part of the trapezius, and this part, when that contracts, it depresses the scapula. And then we have all parts together, or just the middle part. When the middle part contracts, they retract the scapula. If the descending and the ascending parts act together, they rotate the glenoid cavity. Now don't think that if this part of the muscle contracts, it should pull the scapula down only, and if this part of the muscle contracts, the superior part, it should pull the scapula up only. No, it's very important where they insert